and the economy to the protracted COVID-19 pandemic. Taking into account the health and the economy as a part of the 59th Directing Council of the Pan American Health Organization, it will bring together an analysis of current challenges, particularly those that have to do with the social inequity and health with the population, and a debate on the most effective strategies that will enable us to control the pandemic and to promote the strengthening of health systems with resilience. It is a pleasure for me to welcome the representatives with her today. We have Dr. Jarbas Barbosa, the Assistant Director of PAHO, the Executive Director of the Economic Commission for Latin America and the Caribbean, ECLAC, Alicia Barcena. Alicia, once again, welcome to this home of health of the Americas. We also have with us three representatives, delegates from the Directing Council, the Minister of Health from Jamaica, Christopher Tufton, who is also the president of this Directing Council, the head of the Canadian delegation to the 59th Directing Council, Michael Pearson, and the Minister of Health of Chile, Enrique Paris. So with these excellent collaborators, we begin this session. I simply wanted to remind everyone who is participating this afternoon and the panelists that this is a 1 hour side event. So in order to make the best of the time and to be able to finish on time, before we go back to the afternoon session of the Directing Council, I kindly ask you that you stick to the time allotted for your presentation. So without further ado, Dr. Barbosa, you have the floor for the opening remarks. Dr. Barbosa, please. Thank you very much, Amalia. Good afternoon, everyone. All those participating in this side event. The region of the Americas continues to be one of the most unequal regions in the world due to its high levels of the informal sector, urbanization, poverty, social exclusion, and inequality, as well as the fragility of the health systems and social protection. Countries in the region of the Americas have shown significant vulnerabilities, in particular, vulnerabilities to epidemiological shocks, disasters, or economic and social crisis. It is in this regard that the need for articulation between health and the economy as central and necessary components in order to face the challenges of the pandemic brought about by the COVID-19 pandemic has been brought to bear as a result of the serious social impact triggered by this pandemic, making it impossible to have an approach exclusively from public health measures. Therefore, as a result of this, since last year, PAHO and ECLAC began a joint work agenda geared towards strengthening and supplementing their technical cooperation in countries, particularly aimed at providing support in the design and implementation of public policies that will face current and future challenges. These two international organizations share a health approach as a basic right and a public good that ought to be guaranteed and ensured by the state through public policies with intersectoral interventions that will deal and address the main economic and social factors as well as health post-crisis. This cooperation materialized in the course of 2020 in the first joint document, and it is strengthened through 2021 with the development of a new document that is concentrated on the comprehensive response from health and the economy in order to face this protracted pandemic and its impact. In the first document, the work was based on the premise of basing the ineligible link between health and the economy as central elements in order to interpret the problem and understand the path ahead of us. The epidemiological issues therefore could not be addressed in an isolated fashion as a respect to social components. And at the same time, it was clear that we could not have economic recovery, sustainable recovery, without controlling the pandemic. During that second work, we concentrate this on short and medium-term recommendations in order to implement a sustainable agenda for institutional transformations that will guide necessary structural changes in order to ensure the right to health by the population. It is within that context that it is necessary to reinforce the objective of creating resilient health systems that can address challenges in a context of profound uncertainty. Besides, the current document lays bare on the fact that the control of the pandemic as well as the economic response call for leadership and an effective and dynamic stewardship by states through national policies that will bring together health policies, economic policies, and social policies. It is in that sense that we attempt to strengthen the transformation agenda for health that since the approval of the Universal Health Agenda, PAHO has been supporting in the region, emphasizing an integrative approach of it as part of the set of social policies in order to address the environmental, economic, political, and social determinants of health. Thank you, Amalia. Back to you. Thank you, Dr. Barbosa, for your opening remarks. And the first part of this seminar has to do with an analysis from the regional point of view, and beginning with the social and economic impact of the COVID-19 crisis. Looking at it from a regional perspective analysis, and for that we have Alicia Barcena, the Executive Secretary of ECLAC. So Alicia, you have the floor. Thank you very much, and good morning, everyone. I'm very grateful for this invitation, dear Amalia, and I greet Jarbas Barbosa, and through him, through to Carissa Etienne, saying that we're very pleased because of the joint memorandum that we're signing on October 7. We will submit a joint document between PAHO and ECLAC. I simply wish to express my greetings to Christopher Tufton, Minister of Health of Jamaica and President of this 59th Directing Council. So I greet you, Christopher, as well as Michael Pearson, the head of the Canadian delegation, and most especially Enrique Paris, the Minister of Health of Chile. So my most sincere greetings. So I begin with a regional analysis, a perspective analysis, as I was told, with the social and economic impact of this COVID-19 crisis. I'd like to stress the following facts: that there's an increase in global asymmetries and access to vaccines. Also in wealth and financing, we see with concern that the gaps have opened between developed countries and developing countries. COVID-19 enhanced the structural weaknesses of health systems in our region. And we are faced with a paradox of this recovery, because even though we will see growth in 2021 and 2022 because of a statistical rebound and because of private investment, there's very little genuine growth. So it is not that inclusive and transforming. We see an increase in poverty, inequality, informality, and unemployment, and they will remain for several years, which will demand the continuity in government supports. And what is urgent is to have transforming recovery strategies, emphasizing investment in equality and sustainability in strategic industrial sectors. And in here, obviously, I am referring to the manufacturing industries, pharmaceutical industry, and funding of primary healthcare services. First, take a look at the asymmetries, and these are two. One is within our region, and the other one is our region vis-a-vis the rest of the world. And here we are reflecting the percentage of the population older than 18 with this complete vaccination schedule as of September 15. And we see that Chile, Uruguay, and Ecuador head the list of the complete vaccination schedule. It might very well be that they have higher figures, that they even have a higher level of vaccination. But we see with concern that countries such as Haiti, Nicaragua, Jamaica, Guatemala are under, at least below the 20% level. St. Lucia, Guatemala, St. Vincent and the Grenadines, and Jamaica as well, and obviously Haiti. And regarding the rest of the country, US and Canada that have already reached these figures, in the European Union, 74.1, the US and Canada, 69.6. Our region does not have the complete schedule. We have 47.3 as an average and 26.3 in the Caribbean. So in the General Assembly, where I am today in New York, an appeal is launched so that developed countries that have concentrated 39% of the procurement commitments, having only 13% of the population, will deploy greater efforts in order to support COVAX, or else to have a better distribution of vaccines, surplus in some cases. In most of the cases, I would say, our region has been seriously impacted in development. Only 8.4 of the 8.4% of the population, and we have 1.5 million deaths at a global level. And the social consequences have truly been huge, economic consequences, as we've seen. Alicia's message, her screen is frozen. Well, the pandemic finds us with weak systems in the region. You can already take a look at the funding that we have. This is a financing level that doesn't even reach 6% of GDP, which is a goal agreed by members of PAHO in 2014. We only have a few countries in our region, Argentina, Uruguay, and Cuba, that do make it to that level. Chile in 4.6, and Nicaragua 5.1, Colombia 5.5. But we ought to reach at this goal of 6% of GDP, as was agreed on by countries. Once again, there's some countries that are lagging behind, as you can see here. And as an average, a public expenditure in health over GDP in our region is up 3.8%. In countries of OECD, it surpasses 7%. And we also see another issue with great concern, which is the high out-of-pocket expenses that is truly quite significant for countries in general. This means that there is public underfinancing that leads to great dependency on out-of-pocket expenses that as an average represents 33.6%. Take a look at the case of Guatemala, that is all the way up to 58%, which is out-of-pocket expenses in health. It is a very high figure, while other countries, OECD members, have a 21% level because they have more universal health systems. We call this the paradox of recovery, because it is a paradox. Why? Because in fact, we had a huge drop in growth, 6.8%. There was a 5.9% recovery this year, and the next one in 2.9. But the recovery this year is a statistical rebound and not, in fact, reactivating investment with structural changes. And the recovery of GDP will not be sufficient in order to reach, for example, an increase in employment that is so important, or increase productivity. And here this is broken down by countries. And we see that obviously the rebound that we see in 2021 has a lot to do with the statistical drag and other factors, that is to say, increase in export. So you can see China and the US. And there's also private consumption that was stimulated and encouraged by the social transfers made by governments in a very effective way. So we see that all the way up on the chart, we have Guyana that has oil, we know that, but we also have Panama, Peru, Chile with significant growth figures. And by the way, in 2021, we see how this will come down now later on, and we will reach the trend that we had historically, which is a bit lower. And only nine countries in 2021 recover their levels of economic activity that they had in 2019. And obviously in 2022, we add to this 5 additional countries. What struck us the most, and Jarbas already mentioned this on how, or what was the greatest impact, and why are we the most affected region? We see that Latin America and the Caribbean had a drop in GDP that was much greater than advanced economies, that Asia in development, and even Africa and sub-Saharan Africa. It was the most impacted region in economic terms, and in unemployment, we had very high levels in our region compared to the rest of the world. And I would say that populations or the sectors that have suffered the most is the informal sector, young people and women. And we see here that the participation of young people between the ages of 15 and 24 already in 2019 had a major disadvantage compared to the rest of the population between the ages of 25 to 64 with high levels of unemployment in the informal sector. And here we see women on the right-hand side that had significant access to the labor market. And so we see now that we're going backwards. That is to say, women looking for employment of 49%, which drags us back to a decade. It takes us back to 2008. And we also see that if we had not had any public social transfers, poverty and extreme poverty, and this is compared with and without transfers, countries would not have had any social effort in emergency transfers. And if we had not had that, poverty would have reached 230 million people. Fortunately, with these transfers, fortunately in quotes, we have 209, which is no panacea, but at least we're able to see that almost 21 million people did not fall into extreme poverty thanks to these transfers. And the same thing happens with extreme poverty. With transfers, we have a level of 78 million people. If we had not had these transfers, we would have been at 98. And we must acknowledge that in our region, 32 countries had to cover 395 million people, 59.6% of the population. And another factor that was very helpful in family income are the remittances from the big ones. They had record unprecedented amounts in Mexico as well as in Central America. What we did see is greater inequality in the distribution of income, undoubtedly. Now, in 2021, if we do not have the same level of emergency transfers, moreover, if they collapse or if we eliminate these transfers from household or to households, then poverty will definitely see an increase. And so we see that the level of expenditure that we've seen so far in 2021 is of only 0.8% of GDP in 2020. In 2020, the expenditure level was of 1.55. So we're halfway. And that is quite concerning because this could bring down the coverage given to the population from 49 to 29%. So we would go from 326 to 231 million people. And extreme poverty could go up and reach a 14.8, and poverty in general could reach a 35.2 level. There are countries that have already said that they will extend this to the end of this year. And there are other very interesting measures, and it is that they have been replacing emergency measures, but by some labor measures, that is to say, support for those who find a job in the formal sector, and that the government can give them a compensation. This is being done by Chile. We analyze that, and we believe that this is a very interesting strategy in order to support the return to formal jobs. So we're faced with the risk of a lost generation in occupation, in employment. This is a reality. We've seen that we have 167 million students that lost one whole year of in-person schooling with a huge impact on their learning. And we run the risk of having 3.1 million young people, boys, girls, that will drop out of school. And this is of serious concern, because on top of this, this is linked to food insecurity, to what is called breakfast, lunches, school food that also affect our youth and our children. And we also have a huge digital divide in Latin America and the Caribbean, 66 million households that are not connected to the internet, adequate internet services. And in fact, we've seen also a backlog in teenage pregnancy. And this is something that we've seen with the UNFPA 5 years going behind in reducing the rate of teenage pregnancy. So this is quite concerning. And this is what we find with tertiary and secondary schools, where some young people might not go back to school. And obviously preschool education, pre-K, where it is difficult to do tele-education with our younger kids. And another problem is food insecurity. I know that for PAHO, this is an issue of concern, particularly in our region, the impact of food insecurity, which truly increased in a very significant way, particularly in the Caribbean, in Latin America as a whole, obviously throughout the entire world. But in Latin America, the level of food insecurity, serious, severe, moderate, had major increases, particularly in the Caribbean. And this has to be carefully analyzed. The same thing happened in Central America. It is urgent then to promote a transforming recovery, emphasizing the investment in sustainability and equality. And therefore, we in ECLAC proposed, first and foremost, to be very concrete as to where we're headed, where to address our public expenditure. On the one hand, we have to promote investment. Investment is a bridge between the short and the medium term. Our region has a 17.6 in investment, the public and private investment. This is a level in GDP percentages. And take a look at the average. The average is 26.3. Obviously, developed countries don't need that much of an investment in infrastructure. The emerging economies have a 32.9 level. So at least we have to go to the average to increase the investment in 10 points. And this will call for expansive fiscal policies in order to protect social protection and for investment. And we will have to increase the fiscal space, avoiding evasion, reducing tax expenses, and obviously receiving international funding in more concessional terms. We will have to talk about progressive collection, the reach of taxes on income, ownership, wealth, the royalties. They should be equivalent to international standards. We should go up and not down, raise to the top and not to the bottom. And obviously, to include the gender approach throughout the entire fiscal cycle. We have proposed 8 sectors that we believe are those that might achieve this very significant transition because they propose technical changes, that they bring employment and they reduce dependency and energy transition towards renewables. There are many countries that are already working on that, even with a significant direct foreign investment, to invest in basic services and primary healthcare, electromobility, digital inclusion. And in here, I'd like to mention the health and manufacturing industry with a regional approach. And I will emphasize that this sector in particular, and obviously the appraisal of these solutions that are based on nature, marine and land, circular economy, and sustainable tourism, which are so relevant, particularly for the Caribbean and Central America. And now I'd like to refer to the manufacturing industry and health with a regional approach, because I believe that there is an urgency there to move towards a greater health self-sufficiency. We've already seen the asymmetries in vaccination and the difficulties that countries had to go through in order to obtain vaccine, the high dependency on imports. And when faced with these phenomena, the ECLAC asked ECLAC to develop a health self-sufficiency plan that was approved on Saturday unanimously, and where they agreed on 7 lines of action and prioritizing, by the way, the supply of vaccines in the short term, medicines through regional and sub-regional mechanisms, including COVAX, to strengthen COVAX and to strengthen the revolving fund of vaccines of PAHO, to give a priority to strategic coordination between health, the economy, finance, and industry in order to address the chronic underfinancing of health, research, and technological development, and obviously starting off on the basis of an important foundation, which is coordination amongst the 6 entities that have level 4 in terms of regulatory entities recognized by WHO, which are so important in the region, and to use the PAR network of PAHO and existing capacities and skills in the region. The plan and this is a summary of it because I don't have a lot of time. They deal with two objectives. One, the short-term goal, which is to accelerate the access to vaccines and vaccination processes, and in the medium term, to strengthen technological and productive capacities of our region, and obviously to ensure a stable market, research and development, and to facilitate local production. The document, and I can gladly share it with you, both in English as well as in Spanish, has an inventory of capacities in vaccines and research in the region of production. We know what countries can produce or what pharmaceutical companies, what chambers or what associations or what regulatory systems we have, what flexibilities when dealing with intellectual property, and what are the sponsors. So we have over 135 sponsors of clinical essays and how to strengthen primary health care systems. We offer 7 lines of action: regulatory recognition convergence, a regional platform of clinical assays, immediate mechanisms for procurement of vaccines at a regional level, or at least to share them amongst us, consortia, public or private sectors for development and production of vaccines based on what we already have in some countries: Argentina, Brazil, Mexico, Chile. That is truly moving forward with this. Cuba, the development of a regional market, a stable market, because medicines are an industrial complex, a very important complex that generates a lot of jobs, but it also calls for a long-term approach and obviously universal health system access. And we have to do this in close coordination with PAHO, and that is why we're signing this agreement. And the health sector and countries in the region, it is urgent for you countries, for you ministers of health to be involved. And therefore, a universal health strategy, as you have discussed this in PAHO, in order to strengthen primary health care. We've discussed this with Carissa to improve planning processes, access to essential medicines at a local level. Those countries with a good system of primary health care were those that achieved the most with a very effective vaccination. And in keeping with the proposal of PAHO to devote at least 30% of the budget of the public sector in primary health care, and to support these efforts with a regional approach, which is what ECLAC did in convening us, and to have a sub-regional ministerial meeting of Comisca in Central America, the Andean Community, the Pacific Alliance, Mercosur, CARICOM, PROSUR, CARFA, where we can discuss this issue and where we can see how to strengthen the sub-regional and the regional elements. And last but not least, we have to move to well-being. We understand that we have to restructure health and education and to achieve a society of care towards our communities with very short-term proposals to maintain transfers of basic income, but also a basic basket, industrial policies, technological policies for these 8 sectors that I proposed, and the regional integration. We cannot give up. Our region needs additional cooperation amongst us, and we are there. PAHO and ECLAC and many other institutions at the IDB, and they can provide a huge assistance as well as other regional institutions. But in order to do that, we must also bring here to the United Nations, and this is what is happening here in New York, a debate in order to overcome the deficit in international solidarity. Thank you very much for your attention. Thank you, Amalia. I hope that it has been of interest, and I'm very grateful for your attention.
Una excelente presentación y en aras del tiempo paso.
Thank you, Alicia, for that excellent presentation. And now I give the floor to Dr. Jarbas Barbosa, who will be presenting the other side of the coin, or the complement to the coin, something that you included in your presentation. You spoke a lot about health because it's a logical thing to do, but now I give the floor to Dr. Barbosa. Thank you.
I will share my screen. Thank you very much. I want to thank Alicia. I think that's a very comprehensive presentation and clearly highlighting the very important links between health, the economy, social development, and the environment. The pandemic, if anyone had any kind of doubts about these links, the pandemic, I think that was a very important statement that we need to bring together all these dimensions. The pandemic also has worsened the existing inequities in health that we have in the region, and is also compromising public health gains in our region: maternal mortality, immunization coverage, cancer, hypertension, diabetes, and many other chronic diseases that are suffering from the lack of access to medicines to control the disruption in health services during the peaks of transmission. We have some uncertainties yet about the future of the pandemic that I will very briefly address. Now, we have some factors that we really don't control, and as we always say in public health, it's better to be prepared for the worst case scenario and pray and hope that the best case scenario will happen. And also, I think that is important to highlight that the role of the state is crucial. If we don't have this kind of comprehensive response that Alicia Barcena mentioned many times, and also to lead the health system transformation, rethinking, adapting, being innovative, to get the health systems working to achieve the sustainable development goals, including universal health. As you know, COVID-19 cases, it was, if we have most cases happening among adults and young adults, the elderly men were disproportionately affected by death. So this is a very important characteristic of the pandemic in the world and in our region too. We also taking the Sustainable Development Index in the accidents that occurred due to the COVID-19. It's very clear that the countries that have the lowest Sustainable Development Index presented at the same time the most important excess deaths related to COVID-19. Here we have a snapshot about the interruption of essential health services in our region. Many countries reported the slight disruption, moderate disruption, and even severe disruption. And it's important to highlight that the primary care was the most affected because nurses and physicians were diverted to hospitals, to emergency rooms, because people were not feeling comfortable to go to a health center. For many reasons, we really have had a very important impact in many public health priorities in the region. Vaccine deployments, as you know, is still a big challenge that you have. Just to mention that we still have 10 countries in Latin America and the Caribbean that have not protected with fully vaccinated schemes 20% of their population. So we are still lagging behind to protect the most vulnerable groups that we have, the groups that have a higher risk to develop a severe form of COVID-19 and to die due to the disease. We have some in the document that we are launching with CEPAL. We have some forecasts about what can happen. Now we are taking account the public health and social measures that are very important, that we know that can prevent the transmission, not only against the original virus, but also against the new variants, wearing masks, keeping social and physical distancing, avoid crowded spaces. Also, the vaccination coverage dynamics that is changing almost every week. And as the outcome, hospitalization and deaths. With this, we established these 4 scenarios, and the relevance that we have to present this is to highlight what are the strategies that you can implement to transition from low public health and social measures, low coverage, that unfortunately, we still have some countries in the region that are here in this situation, to move all of the countries in the region to the C situation where adequate public health and social measures are adopted, and the countries can achieve a high coverage. This is the best scenario to control the transmission of COVID-19, to recover the economy, to reduce the very important social impact that the pandemic is providing. We have some uncertainty because the virus can change. We can have new variants of concern that if we don't control the transmission everywhere in every country, as we know, we always can have new variants as a natural development of the virus. We also have to work harder to ensure equitable, timely, and affordable access to vaccines and supplies. This is very important to control the transmission. The capacity for effective implementation of immunization programs. Vaccines are essential, but we need many other activities to ensure a good vaccination campaign. We need to prepare the healthcare workers. We need to review the cold chain capacity. We need to have a very strategic communication, a very comprehensive communication strategy, to address vaccine hesitancy in some groups of the population. We also need to address the socio-economic and political structural conditions and the social, cultural, and behavioral aspects that in every pandemic that request that the people change their behavior. This is always a challenge. The recommendations that we are proposing in this document to accelerate vaccination and strengthen technology capacity, first, to ensure effective and homogeneous coverage of vaccines. As I mentioned, not only to have the vaccine, they are essential, but also to provide all these aspects. PAHO is working with the countries. From the beginning, we are providing technical cooperation to strengthen their national immunization plans, to address specific challenges that we have. Probably Minister Tufton will address this, but in the Caribbean, we have a problem with vaccine hesitancy that the Ministry of Health have to address. And also how we can get the vulnerable population social, economic, and cultural barriers that can prevent the people to get their vaccines. We also need to increase regional technological capacities, as Alicia also mentioned, and this is important that we can work together. Yesterday, we have two very important events. First, our Directing Council approved unanimously a policy document, a very strategic one, asking the member states to work together, asking the Secretariat to provide technical cooperation to increase and to strengthen the capacity that we have in Latin America and the Caribbean to produce medicines, vaccines, and medical products. And at the same time, yesterday, we have also announced the two first hubs that we have in Latin America and the Caribbean to develop and produce this new technology for vaccines, the mRNA vaccines. Yesterday, we announced a public project in Brazil, a private project in Argentina that will receive technical cooperation to be a very concrete step to move forward this important achievement to increase the regional technological capacities. We also need to strengthen primary health care. This is very important that we can, at the same time, increase the public expenditure in health, but how to split this budget to have primary health care fully funded with the human resources trained with the capacity to provide a comprehensive package of care to the people, including prevention, promotion of health, surveillance, and all the public health priorities that we have. Also important to call the attention for the intersectoral focus to our health policy. It's very important to strengthen at the country level this dialogue between the Ministry of Health and the other ministers and other sectors in order to build up agendas that can address in a comprehensive way not only the healthcare, but also the social and economic determinants that are very important to change for the better or for the worse the health of the population. Finally, we also believe that it's very important to promote solidarity between countries with regards to vaccine procurement and other health technologies. The PAHO's revolving fund, as you know, is providing this kind of access for 42 years now, and we are working with the countries to strengthen their capacity. At the national level, to encourage and to stimulate dialogue between health, finance, international relations, industry, in order to have this comprehensive response to this very important public health crisis, to articulate and harmonize technical cooperation between international, regional, and national actors. As we have been working together yesterday during the announcement of the two projects we had in the Inter-American Development Bank that addressed the topic offering financial support to the projects. We are working, also inviting the Ministry of Industry, Commerce, Economy to be part of this dialogue, the two regional dialogues that we had about this topic. How to strengthen regional and sub-regional governance mechanism in health. We have a very well-established mechanism in the Caribbean, in Central America, in South America. We are still dealing with the need to strengthen the sub-regional mechanism that can put together or to come together all the countries on the same objectives. We have very good dialogue with PROSUR, with CARICOM, and with CIFCA, and I think that this also can be a very important platform to strengthen solidarity and cooperation, collaboration that is crucial to the response. Thank you. These are some of the ideas that are presented in our document. Over to you, Amalia.
Muchísimas gracias, Dr. Barbosa, y verdaderamente.
Thank you very much, Dr. Barbosa. And yes, the approach here is fully comprehensive as we look at this from a regional perspective. We are now going to hear a national perspective, which, as we know, is where the more difficult fights are waged.
Tufton, to give us the perspectives from Jamaica. Minister, the mic is yours.
Thank you very much, and thanks to those who have spoken before me. Very comprehensive, and there's a lot that we can learn from this. The COVID-19 pandemic has placed a tremendous burden on health infrastructure globally, resulting in a huge cost of lives lost, social displacement, mental health challenges, and economic fallout. Approximately 20% of persons require hospitalization, and maybe 5% require high dependency care. With over 200 million confirmed cases and over 4 million deaths, it is clear that the number of admissions have stressed health systems across the world. Many who are not ill enough to be hospitalized are sick at home. With a rapidly spreading infection, there is a clear impact on the workforce. As the numbers soar, there is no question in our minds that preventative measures had to be put in place. The measures to prevent the disease, prevent social interaction, and the conducting of businesses in a normal way. In other words, there have been side effects to the COVID response. It was clear that the businesses that depended on social interactions would suffer the most, and other businesses that could not adopt would also suffer. In a region that depends heavily on tourism, and in countries where economies depend on service industries, there is bound to have been an economic fallout. The pandemic has resulted, therefore, in a health crisis, a social crisis, and an economic crisis. For many developing countries, COVID-19 has affected and will continue to affect the debt burden, investments, human capital, and labor market participation, as well as global trade and supply linkages. It is important to understand how the pandemic has affected the economy. COVID-19 has led to a global recession, which has been described as the deepest since the end of World War II. In 2020, the global economy, which was forecasted to grow by 3.4%, contracted by 3.5%. Despite this, The world economy, according to the World Bank, is poised to stage its most robust post-recession recovery in the last 80 years in 2021. That is good news, but the rebound is expected to be uneven across countries as major economies look set to register strong growth, even as many developing countries or economies lag behind. In addition to this, Latin America and the Caribbean are characterized by a high dependence on imports of raw materials, medicines, and other health technologies from other regions. ECLAC, for example, estimates that in 2018, only 4% of a Latin American and Caribbean series of health products imports came from the sub-region itself. This forecast of a vastly different recovery process for developing and developed countries will result in many countries in our region grappling with the effects of the COVID-19 pandemic for a very long time to come. Let me now turn my attention quickly to the Jamaican experience. Figures from the Planning Institute of Jamaica show that for fiscal year 2020-2021, from April 2020 to March 2021, Jamaica's real GDP contracted by an estimated 11%. Most industries have been affected due to reductions in the demand and supply of goods and services. The largest contractions were recorded in the high contact industries such as hotel and restaurants, down 65.5%. Other service industries, which included recreation, entertainment, and sporting activities, down 28.2%, and transport, storage, and communication, down 13.6%. The contraction in economic activities has affected employment also. There was an 11.9% reduction in employment in July 2020 relative to January 2020. To put this into perspective, employment in Jamaica declined by 7.7% over a 3-year period due to the global economic crisis, which started in 2008. The impact of COVID-19 are obviously worse. These developments are expected to lead to increase in poverty and inequality. The challenges experienced socially as a result of the COVID-19 pandemic are far-reaching, spanning several sectors. There have been disruptions in service delivery in education, health, and assistance to the poor. In terms of program delivery, programs which rely on face-to-face methods of service provisions have been impacted by measures implemented to limit the spread of the virus. The road to economic recovery will be determined by how quickly the public health system can reduce the threat of the COVID-19 disease to the economy through effective preventative measures such as behavioral change and vaccinations, and adapt to the increasing demand on the health sector by increasing resources to manage COVID-19 cases, such as that it does not affect the delivery of routine health services. While public education and vaccination campaigns are ongoing, behavioral change and vaccination are largely dependent on several factors that are outside our immediate control and may take time to achieve, especially with emerging variants and increasing COVID fatigue. Governments must recognize that increasing capacity must proceed hand in hand with increasing the pace of vaccinations. And that's always a challenge for several reasons. As the health system must learn to accommodate COVID-19, so also must the business sector. Several factors will affect recovery. The ability of firms and workers to pivot, to implement policies to stem the spread of the infection in the workplace, and to apply innovations to allow businesses to continue despite COVID will make a difference in our recovery efforts. Health in all policies must now not only be a cliche that we call upon when convenient, it must become a way of life. Businesses must now build in their operation plans attention to infection prevention and control, emergency response plans, and contingency plans for health emergencies. The promotion of healthy lifestyle and the implementation of workplace policies that ensure a healthy workforce will contribute to a stable workforce. Finally, while some countries in our region have started the recovery process, the process remains fragile, given new variants and the level of debt, which restrict the level of fiscal intervention. The economic outlook is at best precarious. Countries cannot afford to continue to open up and shut down as the number of cases increase or decrease. The health sector must have the flexibility to adjust to the new demand, whilst at the same time working to decrease demand for health services through prevention. Sustained and increased public financing in health will be required to support additional resources that are needed. Economic recovery is dependent on this. Economic recovery is dependent on all of us. Health is inextricably linked to our economic recovery. Thank you.
Thank you, Minister Tufton, and for acknowledging the important role of health for the recovery of the economy. Music to our ears. So with that, I pass on to Canada, Michael Pearson, for their presentation. The mic is yours.
Thank you very much. I'm always humbled to be between ministers, minister following and minister before. Very much appreciate the comments that are made by our elected officials, who ultimately are the ones who, are the ones most important to lead us in this kind of crisis. And I want to thank PAHO as well for the invitation to invite Canada to speak about some of our national perspectives and experiences, and particularly lessons learned. And I'll start by saying the most fundamental lesson learned for us or lesson learned is not the right word, the most fundamental reality for Canada, and it's similar with, I know, a number of PAHO member states as well, is that we are a federal state. And as a federal state, there are divisions of responsibility when it comes to health in particular, quite significant differences in responsibility that have been very important in the context of managing this pandemic or responding to it. As a federal government, of which I'm a representative, we are responsible for overall national public health guidance and advice, obviously for managing international issues, including border management, for providing economic support to our publics, which has been a particularly important issue during the pandemic, how to ensure the economic impact of the pandemic, and particularly of the public health measures that were undertaken can be mitigated. And by contrast, our subnational authorities, primarily in our case, provinces and territories, 13 in all, they're responsible for public health measures. So the measures that are taken, whether they're lockdowns or partial lockdowns or mask mandates or any of those kinds of issues, vaccine distribution or particular administration of vaccines, those are all at the provincial and territorial level. And I'm highlighting that to start with because that division of labor between the national and subnational authorities when it comes to public health management during a pandemic such as this one has an impact on how the overall country is affected and can implement a strategy for dealing with a pandemic. That will be the same in the future as it is today, but clearly the pandemic has been able to teach us some real lessons about how that collaboration between the national and subnational authorities can work effectively. Okay, I'll move to the next slide. So we have just a very quick picture of our current situation in Canada. The map of our country, as you see it there, is really a capturing of our current situation of infection rates. It reflects the fourth wave, which I'll come back to in a minute. We'll see that in the next slide a bit more, but you'll also see the different colors of blue there. You'll see the different impacts that it's having in different parts of our country. And this is at the current time. And this is what I want to just, from my earlier remarks, highlight is that depending on public health measures taken in different provinces, there is an impact on how the various waves of the pandemic have affected the public. So it's both not just a function of population, higher numbers in our two biggest provinces of Quebec and Ontario, but also a function of public health measures. So you see to the left there, Alberta is in a proportionally the most difficult situation right now. And that's a function not just of population, or in fact, as function as much of the public health measures and approach that was taken by the subnational authority there, as it were, the numbers of people in that province. So that's one consideration just to highlight on the current side. Also on the current side, and the two bottom boxes in particular, I want to highlight on the right-hand side of that slide are the indication of what the fourth wave reality has been, and this is not unique to Canada, but is something, of course, that is very significant in our country. Number one is that the cases, which of course at the beginning of the pandemic were almost hugely disproportionate to people 60 and over, are now significantly disproportionate towards youth, up to the ages of, from basically young children to 29 years old. That's one factor that we're facing in the fourth wave. The other one is what we're calling the, as it's been called in many other countries too, a pandemic of the unvaccinated. So about 75% of the hospitalizations and emergency ICU admissions are people who are unvaccinated or only partially vaccinated in Canada. A very significant difference, and indeed is having some impact on vaccination rates amongst those who are unvaccinated, but also as a reflection of the challenge that's faced in public health in trying to encourage people to be vaccinated. My colleague, the Minister of Jamaica, who spoke to us before me, made a few comments about those challenges, some of which are in governmental control, and some behavioral change, and some of which are often less in our control. Next slide, please. So this is a really good snapshot of our experience over time, and I just want to highlight again, different countries have had different experiences, but in many cases, very similar ones. So the very far left, you talk about what I would say is wave one back in March of 2020, when the pandemic was first declared. Relatively low spike, as you see in that wave. And that was because of a major lockdown across the country, 90 to 95% adherence by Canadians to those lockdowns, willingness to stay at home, work from home, be at home. Obviously, different countries, particularly different member states in the PAHO region, don't necessarily have the same capacity that we had to be able to really lock down everybody. But that was the impact, an ability to try to quickly snuff out the impact of the pandemic on us. So that led to that bottom curve, or that curve there in the summer of 2020. Then you go to wave two, which is that second spike there. And that in wave three, over the fall and then winter of 2020, 2021, is a consequence of two things. One of the looser, what I would call looser or not consistent lockdowns between provinces and territories. And again, back to my earlier point about different provinces and territories took different public health measures to deal with emerging and rising infection rates. So different approaches having that effect. And obviously the length of whatever lockdowns were put in place, how long they were put in place for, again, different from different provinces and territories. Clearly the other impact, which was cross-country, was the variants, which of course is an ongoing issue that we're managing even up to this day, as new variants of this insidious virus keep emerging, what impacts they have on the wave. So then that takes you to the right-hand side, wave four, which is obviously still ongoing, but where in some parts of the country we were already seeing plateauing and a drawing down, the pandemic of the unvaccinated, as I called it earlier. This is the impact also, of course, of the Delta variant. But again, the much lower peak there that you're seeing is because of vaccination. 80% of Canadians, almost 80% of Canadians, I believe, are now fully vaccinated. And that's clearly had an impact on the degree of the wave that we have faced in this, what we call the fourth wave. Next slide, please. So over that same time period that I just described, a little bit of a snapshot, apologies for the small text, I know this will be distributed to everybody, of the various actions, government and impacts on publics that were results of those actions. So if you look at the far left, the government action, the massive, this is what I would call the good news at the beginning of the pandemic, the clearly significant, including at the national level that I represent, huge numbers of decisions that were made to mitigate the impact of those lockdowns. So if people had to stay home, how to ensure that their jobs were not lost, that their employment was maintained, even if they were working from home, or even if they were just being at home. Restaurant workers or others who allowed, we had systems in place or mechanisms, programs in place to allow both employers and employees to still receive income, even though they were not able to physically work. This was a really significant and important, hugely expensive, but a public health decision that needed to be made by both federal governments, particularly led by the federal government with provincial and territorial support. And at the bottom, underneath that, you see the adherence rate. 90% of Canadians adopt public health precautions. So this is the challenge. My Minister of Jamaica talked about fatigue. Well, obviously we didn't have fatigue at the outset. We had huge adherence at the outset. The challenge is, of course, over time, how do you maintain adherence, particularly as you go through these waves? And what are the economic as well as other and behavioral measures that you can put in place that address those kinds of questions? So as you move to the right, you start getting the bad news, higher unemployment rates, but again, mitigated by the ability to provide resources, funding to those who couldn't work. But the health impacts at the bottom there, the declines in mental health. This is something obviously we've seen consistently happening and even increasing over time as we go along, that notwithstanding being able to give people financial support, the impact of isolation on mental health is not to be underestimated, cannot be underestimated. Then as again, you move across in the middle of this slide, there's a reference to at the top, July Atlantic bubble. So I won't describe what Atlantic bubble means, except to say that we had in Canada, let alone what happened internationally, border measures put in place to mitigate the movement of people in order to mitigate in turn the spread of the virus. It's had an enormously effective impact in our Atlantic provinces, who basically said to the rest of Canadians, you're not allowed in here. And as a result, they were able to actually manage the virus and the outbreaks in a very relatively low level over time. But again, that is a challenge, not just domestically, how you establish those kinds of isolation measures region to region, but the knock-on economic and other impacts, tourism, et cetera. Atlantic provinces are particularly popular in the summertime for tourism. At all times of the year, but particularly in the summertime, very little tourism could take place, internal or otherwise. That had an economic impact, but the decision made there to have a public health measure in place to mitigate the impact of the virus and then take the consequences when it came to issues like tourism. And so just it's really the impact of changing policies by different authorities over time as we move down through and this is obviously ends at March 2021. At the end, it's the beginning of the third wave that was really significant in April. But even there, you see January of 2021, one of our provinces, Quebec, introducing an overnight curfew, something which is common in many countries, including in PAHO, and not just for health emergencies reasons, but very uncommon in Canada, to actually tell people that between 9 o'clock at night and 7 o'clock the next morning, they weren't allowed to leave their homes, to get in a car and go anywhere, was a dramatic measure, an unprecedented measure, and I actually saw a public health benefit of that. But again, that was one province taking that decision. Other provinces did not take that decision, including Ontario, the province right beside Quebec, which never imposed a curfew. So, what are the impacts of these divergent policies and provincial approaches or subnational approaches? How do you manage a public health emergency in the context of those divergent approaches? It is a challenge, a lesson learned. How do you do that effectively? Next slide, please. Or 2 slides more, I guess, to slide 8. So, these are the things we have learned, and I want to highlight about lessons learned. There's a series of 7 there, and there's an 8th one that I want to come to, which is what I call the wild card. So what we learned, notwithstanding these divergent approaches that we've been taking domestically, is there are some things that did work well. Collaboration. So notwithstanding different approaches, a lot of conversation happening between public health authorities, in particular between national and subnational authorities, to try to see how much collaboration, both with respect to public health measures and with respect to economic measures, is there ways that we could do things? And we've learned some effective lessons, and indeed did some things successfully to do that. Evidence-informed decision-making. This is one of the hardest things. How do you use science, which evolves constantly in the case of a pandemic like this, to inform decision-making? A lot of the debates that happen about mask mandates, for example, in Canada, and when they should be imposed and how they should be imposed and how long they should last, were based on evidence that was evolving over time about how how much of a threat any particular virus, the virus was, particularly as it mutated, and things happen there. So how do you do that in a way, in an imperfect way, which leads to precautionary approach number 5 there. I want to highlight that we one of the ways of doing that is to say, okay, we're gonna be precautionary. We're gonna say, put masks on, keep them on. And that is actually what you're seeing today, even as we start moving out of the 4th wave, an ongoing public adherence to use of masks in Canada, which is unlike our colleagues from the United States, is not really a debate. There are debate in some areas, in some provinces, in some parts like Alberta, and what the consequence of that was. I'm not saying that one is completely related to mask mandate, but precautionary approach on issues like mask mandates have been something that have helped Canada through this. So I will not talk about all the other ones in detail, don't have the time, but I want to say there is a point 8 there, not highlighted, which is what I would call the wild card, and that is the impact of politics. Again, what national authorities think is necessary and what is right to do, what subnational authorities think is necessary and right to do from a public health measure standpoint. We saw that played out at the national level in our election campaign. National election campaign just ended 2 days ago. Again, different parties have different approaches. This is going to be an ongoing challenge. How do you create unity, notwithstanding the fact that the politics will always create a division at the same time? Next slide, please. On the collaboration, again, just to very much highlight how collaboration for us focused on equity, among other things. And that's why we focused on racialized communities, Indigenous communities, religious minorities, remote communities. A lot of these coming together. A lot of our Indigenous communities live in remote areas of our country. How to make sure that we learned the lesson of H1N1 from 2009 in that regard, where Indigenous communities were disproportionately impacted by the virus. We've reached out with vaccines, for example, to Indigenous communities in Canada, with the consequence, and early on with the consequence that infection rates amongst Indigenous communities was significantly less, disproportionately less than it was in 2009 with H1N1. So these are things we've been learning lessons. How do you then try to apply those lessons from a public health perspective, using various mechanisms in order to ensure that you not just mitigate to the public as a whole, but you mitigate with particular populations which can be more vulnerable. And that means, another example, you don't just have people come to a vaccine center, you take vaccines to local communities and you administer vaccines in local communities, particularly in populations which may not otherwise be willing to go to a vaccination center. Next slide, please. So again, I will not belabor this, but these are the economic elements that we took in place. I've spoken to some of those, and we're happy to talk further about that. Next slide. Our approach to vaccines. So this is what I just discussed, the various measures that are not just science-driven, but the transparency, the coherence approach, fairness and equity in particular, ensuring that we took that approach that ensured that all populations were addressed as effectively as possible. And by the way, one of the issues we took, and one of the things I think the regions have done as well in other parts of PAHO, is a mixed dose strategy. So lack of availability of certain vaccines, let's apply other vaccines. A lot of AstraZeneca, for example, applied in Canada early on, but a lot of people who took a second dose, which was not AstraZeneca, it was an mRNA, and that was based on science advice to saying the efficacy of that was okay, the safety of that was okay. So that was a decision, a public health decision that was made and had a clear, important impact on Canadians. Okay, now I'm going to skip to slide 13. Just looking ahead, I want to highlight 3 points. I know I'm over time. Strong public health system, how important that is. Risk communications, how important it is to communicate with your publics on an ongoing basis about why you're making decisions from a public health perspective. We're moving now, and we'll be moving eventually from a pandemic to what we'd call an endemic situation with these variants. We're not going to ever lose this virus, but how do we create basically a situation where it's like the seasonal flu, and we get people to address it on that basis? And then finally, that high quality evidence, public health intelligence, how important it is to work globally, not just locally, on sharing intelligence to inform decision making. And then finally, I'll just end off with our slide 14, the global snapshot. Those 4 pieces: mitigating economic and social costs, working towards health equity, containing the spread of new variants, and preparing for the future. These are all pieces of the puzzle that both the public sector and the private sector and other sectors of the economy need to work on together in order to ensure that we can be successful in not just ending this pandemic, but in managing future pandemics. Thank you very much.
Thank you very much, Mr. Pearson, and for highlighting principle number 8, and also for recognizing the necessity of health equity in the response. And with that, we go to our next presenter. Le paso la palabra
I would like to offer the floor to the Honorable Minister of Health of Chile, Enrique París. Minister, the floor is yours. Thank you very much, Amalia. Thank you for having me. Allow me to acknowledge the Director of PAHO, Carissa Tien. I imagine that she is listening in to the Executive Secretary of ECLAC, Alicia Barcena, whom I commend as well for her fantastic presentation. It provided great guidance. I should like to also acknowledge Alberto Arenas, who is with ECLAC as well and whom I've known for many years. I wish to also acknowledge the Minister of Health of Jamaica, as well as the distinguished delegates who are with us for this side event. I'd like to begin by thanking PAHO for putting this side event together and also for allowing us to come on to share our experience regarding the strategic link between health and economy. Everyone knows that the COVID-19 pandemic has had a number of impacts on health, on society, on the economy, among others, and has particularly affected those who are the most vulnerable. And this is very regrettable. This is something that usually happens with any pandemic and across all countries. This has also compounded the challenges that already existed prior to the pandemic. I would like to just, as a reminder here, mention a number of key issues: the fact that health is a right, how important social factors are, as we heard from the Executive Secretary of ECLAC a number of times, also the need for an inclusive approach. And of course, how important it is to try to be as collaborative as possible, particularly as countries in Latin America and the Caribbean. As we think about the differences that exist between countries, unfortunately, this is across a number of different dimensions, one of these being access to vaccines. This is why it's important to both recognize and continue to boost efforts from PAHO through mechanisms like COVAX, but also what we have heard during this event, which is that Latin America and the Caribbean need to increase their R&D for scientific issues like producing vaccines for their countries, and to also ensure equal and fair access in a timely manner and ensure that everyone has access to vaccine programs. Now, in terms of what we're here to discuss, Chile, like many other countries, had to impose stay-at-home orders, seal the borders, close down schools. And we know that when you close down schools, many children also lose access to nutrition. This led to a decline in GDP that was upwards of 6%, as well as job losses that fortunately we have started to get back. All of this had an impact on household income, as well as the mental health of our citizens. Here in Chile, at least, the impact was severe. We know that medical leave for mental health issues is close to 30% higher than it has ever been in Chile. And there was an imposition on the government to increase public spending on medical issues and also provide support for individuals and businesses who are all impacted by the pandemic. Now, all of this is happening as health expenditures have been increasing. This went up in 2021 by 8.9%. And obviously, as we have heard during this session, we increased spending on primary health care. And I also agree with what other presenters have said. Primary health care is absolutely vital. It needs to be a priority and it needs to meet the needs of individuals, but not where we are, rather where they are, close to where they work and close to where they live. Under these circumstances, the government needed to go back to its toolbox in order to find the best way to address the consequences from this pandemic. And there were 4 tools that turned out to be key. The first was an action plan to combat the coronavirus. It started with building hospital capacity and tripling, and in some sectors, quadrupling the number of beds in ICUs in our public hospitals. Obviously, this also led to increasing our staff and increasing use of technology, as well as other equipment that needed to be distributed. Also, there needed to be an integration for public and private healthcare facilities. And this is key. This was something unprecedented in Chile. There were prices set for receiving care in ICUs, and the same rate was set for both public sector hospitals and private hospitals, which was an eye-opening experience for us because it led to talk about healthcare reforms in order to ensure that there is universal healthcare, or at least to allow everyone in Chile to have the same kind of care, whether they go to a private hospital or a public hospital. This sort of coordination was necessary in also combating efficiently this pandemic and ensure that there was an integrated hospital network, which was once again unprecedented in Chile. Testing, traceability, and isolation capacity was also built with 20 million tests administered. That is over 1.1 tests per inhabitant. These were PCR tests as well as antigen tests. We have contracted or hired rather over 10,000 contact tracers for our strategy, and also implemented 26 contact tracing facilities throughout the country. And we implemented the strategy for over 8,000 beds in healthcare facilities, which benefited from the support of PAHO. There was also a social safety net created for more support for families. This evolved over time. And here it's fair to say that when we take a look back, it's easy to understand why there has been criticism in the beginning, but as time went on, assistance for families increased. And there was a fiscal response that was put into place, securing close to $30 million for those who needed it the most. Those funds allowed for strengthening the social safety net and providing coverage to close to 15 million Chileans. 3/4 of all people in Chile are covered, and these steps include emergency family assistance, as well as employment protection laws, COVID-19 bonds, as well as other financial assistance instruments, solidarity assistance for the middle class, employment subsidies. This was an initiative that was started with the pandemic, with the offering of groceries for households, which we believe that was going to be key in addition to any financial resources. The third point was the step-by-step plan, and this was a phased reopening strategy in order to address the pandemic based on the reality of each of the specific spots in the country. As you know, Chile has a very peculiar layout. We have different climates, we have different realities across the country. And obviously, this plan here was what allowed us to make decisions more region specific. This helped us curb cases of infection and exercise caution as we implemented these steps. And this was all based on evidence-based recommendations, as well as WHO and PAHO recommendations, as well as the COVID-19 Advisory Council that we established and provides guidance to the Ministry of Health, and is made up of experts. The vaccination plan was the fourth item, and developing the COVID-19 vaccine was something that from the beginning in Chile and throughout the world was seen as a vital tool to combat the pandemic. Now, in light of all of this, and understanding that immunization is a public health strategy that is very effective, and that in addition to health benefits, this can also improve economic and social performance and help economic development in Chile. There were steps taken to ensure access to vaccines. For this, there was an interagency committee. This was also mentioned by other presenters. This allowed for joint work with the Ministry of Technology, of Health, of Foreign Relations, as well as a scientific advisory committee that had been working in Chile for a long time, but in this case, it specifically focused on COVID-19 vaccines. So far, this has helped us get over 90% of our target population vaccinated. We have over 13.8 million who have received the first dose of the vaccine, and 88% of the target population is fully vaccinated. This is 13 million people. In addition to all of this, and very early on, we started to provide booster shots. The recommendation from the WHO was to prioritize these doses. This is why we prioritized the elderly, as well as patients with chronic diseases and who were immunocompromised. And so far, we have 2.7 million individuals who have received a booster shot. And that is not always with a booster shot of the same vaccine that they received for the first two doses. And this was all decided based on the antibodies that were found in tests for these individuals. Also, with the approval that we've gotten from the equivalent of the FDA in the US, started to vaccinate children 6 and older. We know that it's important for children to go back to school, and we know that usually as the virus tries to stay alive, it looks for those who are unvaccinated. And so we found that the best way to keep the virus from continuing to spread and from mutating was to vaccinate this age group. We've also provided primary care to our government employees, and this is why we believe we need to continue to bolster our primary health care. Thanks to work done by city officials and by government employees at all levels, we were able to advance these steps, and also thank the Chilean government for what we were able to do by working together with a number of different labs. We would like to hail the efforts of PAHO for its work on advancing vaccines and other health technologies. We know that challenging times usually come with an opportunity to think about ways to move forward and to think about things differently. We have a university that is currently working with a European business in order to manufacture, or at least to help approve the manufacturing of vaccines in Chile, in order to also provide these vaccines to the rest of the countries in Latin America and the Caribbean, and not only within our country. I would like to also highlight here what Alicia Barcena mentioned, when she said that it's really important to boost manufacturing, specifically when it comes to health and research. This needs to be one of the good things that come out of this pandemic. And once again, we commend COVAX for that effort. All of this has been happening in a healthcare context that seeks to ensure that there is universal healthcare coverage by 2030. There are a number of the health targets that we had set that we have updated for the 2020-2030 period. We've also included environmental targets in our original targets involving the environmental ministry, and also looked at including autism as one of the issues taken on by the work that we're doing. And Chile is also focusing on providing quality services for at least 85% of those who are suffering the most from health issues. Now, this is something that goes back to a tradition in Chile. In Chile, Healthcare has always been seen as something that the government should provide and ensure is provided. This has been a challenge for the vaccines. And also the government cannot say that everything that needed to be done was done, because what we know is that what has happened in Chile has been the fruit of what many have done, and we have learned from other governments and from what others have done in the region. And the different conditions that have been included showed a sudden drop in 2020 for the services that were provided, and that is because chronic diseases and cancer treatment, surgeries, and other specialty doctors' visits had to be put on hold because of the pandemic. We hope to bring that back as the pandemic disappears. If we add to all of this the lack of physical activity, as well as the economic challenges that are linked to the pandemic, the road before us is daunting. But this is something that I believe that we can do in solidarity by bringing together all of the countries in Latin America and the Caribbean. And the reason for this is that we have heard this in other meetings, and we hear this in the song. If we're all of the Americas, we're all brothers and sisters, and we're called on to work together. We thank PAHO once again for this opportunity to be part of this event of the Directing Council. Thank you very much. Thank you, Minister, and thank you also for your call for solidarity and for all of us brothers and sisters in the region to come together and to continue to wage this fight. So let me now offer the floor to Dr. James Fitzgerald, who is the Director of the Health Systems and Services Department. He's going to provide closing remarks as we move into the next session.
Thank you very much, Amalia. Just to really recognize the excellent comments and note the strategic linkages, I think, between health and the economy. And just to inform all the participants that we will be taking this agenda forward in the joint work that we are doing with CEPAL and launching the publication on health and the economy within the context of the prolonged health crisis in the region. So we look forward to that. That will be on October 7th, and we hope that everybody will be able to join us then. Thank you very much.
Thank you, James. Muchas gracias, James. Y con esto llegamos al final de nuestro programa.
Thank you very much, James. This brings us to the end of our agenda. We look forward to seeing you all on October 7th for the launch of the publication. Thank you all very much for being with us.
Gracias, saludos a todos.
Gracias, muchos saludos.
Hi, Alicia.
Muchas gracias. Hi,
Saludos.
Carissa.
Gracias,
Gracias.
Alicia. Hola.
Adiós. Gracias, ministro.